Hello, 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 and welcome to Nursing News You Can Use and live at 5. I'm Tina Baxter, your host, and today is January the 14th, 2026, and I want to thank you for tuning in today. First announcement we usually talk about, and we kicked off the show. We've given our affirmation for today, and usually have something from a calendar or something that I wanted to share, but instead I wanted to share a little bit of wisdom that I learned today. I'm participating in what's called the 31 Day Wisdom Challenge with Pedro Deo and 100X and Kingdom Seekers, and I was listening to that, and one of the things that really jumped out for me was the fact that if you are expecting a harvest, you have to um, be okay with the mess. In other words, you're not going to plow a field and not have some dirt get on you. You're not going to do some planting without getting into the dirt. So you got to put the work in. And if you want to get the harvest, you want to see your dreams come to pass, you have to, be willing to put up with the mess to get there. And so that is my inspirational thought for you today is don't let the mess discourage you, knowing that the mess can be part of that process of getting what you want in your dreams. So I just want to share that with you. I thought that was very interesting. That's one of the insights that I had from that event. I love being in the 31 Day Wisdom Challenge, by the way. If you haven't done it, it's on the YouTube. You can always sign up and go to that and find it there. Very inspirational as we go through the book of Proverbs. So I want to get into the news because there's a lot to cover. And of course, we're going to start with the strike that's happening in New York. Yes, everybody's talking about that, so why not start there? I wanted to follow up with some of the articles that we had from last time. So this is coming from the Fox 5 New York, and it says Mount Sinai fired 3 nurses for interfering with patient safety a week before the strike. So let's go ahead and get to the story. It says 3 nurses were terminated for interfering with patient safety by, quote, deliberately sabotaging emergency preparedness drills, according to Mount Sinai. This sabotage reportedly included hiding supplies designed to care for newborns in conference rooms, according to Mount Sinai. Local union leaders say that the city nurses are striking against hospital administrators failed to meet their demands for better pay, safe staffing levels, fully funded health benefits, and stronger workplace protections, which are all the things that nurses all over have been asking for. Despite no deal being reached, some nurses have returned to work. A spokesperson for Mount Sinai said about 20% of its nurses crossed the picket line on Monday, and the hospital expects more to do so in the coming days. The other side says a New York NYSNA leadership's demand that a nurse not be terminated if found to be compromised by drugs or alcohol or in the job. Another example of putting their own self-interest before patient safety. This is according to Senior Vice President of Strategic Communication Joe Solanese for the Montefiore Medical Center in the Bronx. Montefiore also reportedly claimed that the New York State Nurses Association are pushing for a highly excessive increase in pay. I wonder what highly excessive means. As they double down on their 3.6 billion in reckless demands, including nearly a 40% wage increases, we remain resolute in our commitment to providing safe and seamless care. That makes me think about this. Now, you hear these numbers, you think, oh my gosh, these nurses are demanding so much. But let's look at how much the hospitals bring in revenue, and the fact that they're not talking about doing this all at once. And you're talking about nurses over several hospitals. You're not talking about one individual nurse here. And if you don't have the nurses to take care of the patients, what's going to happen to your hospital? Who's going to be there to do the work? So, Parag Ammon Esquire, a Los Angeles-based business and employment lawyer, told Fox that the ongoing New York City nurses strike is the largest in city history. The New York State Nurses Association has yet responded to requests for comment to Fox. So at that time, that article came out. So then let's follow up with what's going on, because It says the New York governor, which you may have been aware, has now declared a state of emergency. This is from nurse.org over the walkout from the nurses. As New York nurses walk out in protest over unsafe staffing, a new state emergency order underscores just how deep the healthcare staffing crisis has become. On January 9th, 2026, Governor Kathy Hochul issued an executive order number 56 declaring a state disaster emergency in Bronx, Nassau, and New York counties, as well as neighboring counties, due to severe healthcare staffing shortages. The order came as a major contract disputes escalated across multiple New York hospitals. The New York State Nurses Association has already delivered 10-day strike notices at a dozen private sector hospitals, warning that a walkout could begin January 12th of 2026 if agreements were not reached. By January 12th, reports indicated that thousands of nurses began striking. At a high level, Executive Order 56 gives the state more flexibility to keep hospital staff during a shortage. Specifically, it temporarily suspends certain licensing and practice restrictions so that clinicians who are licensed and in good standing elsewhere can work in New York without penalties related to a lack of New York licensure. So, in other words, if you are in Pennsylvania next door or New Jersey, you can come over and work in New York, with your license, or from Indiana, actually. If you want to fly out there, you can do that. The order includes pathways for registered nurses, LPNs, and nurse practitioners licensed in other states to practice in New York, as long as you're, within, has a good license, right? Physicians and physician assistants are under similar good standing provisions. New York also posted a modified order, 56.1, related to the same emergency declaration, extending it throughout February 8th of 2026 with the option for further extension if needed. So, what does this mean? It says the executive order is not about the strike itself, but it directly affects the working environment created by staffing instability during periods of threatened or active job action. Hospitals may, quote, bring in out of state clinicians, including travel and temporary staff, shift assignments, close beds, or adjust services, and change operational flow to maintain coverage. So again, the nurses and the unions are centering their demands around safe staffing, workplace safety, benefits, and patient care outcomes. So on social media, there's different things that nurses are talking about. They're talking about workload, safety, retention during negotiations, potential walkouts. So these are just the same and the similar things that you see that the nurses are posting on social media. So we're going to keep an eye on what's happening with this. If you want to hear more about this story, head on over to nurse.org. They do excellent coverage on all of these topics and issues. I so appreciate them and love the work that they do. All right, so let's get back to, yes. So here's another story that I wanted to share here. And this is one of the reasons why you have things like these strikes. This is another reason. This is again nurse.org. Report on this: 74% of nurses are emotionally exhausted. A burnout study by Joyce University revealed. Not surprising. Nurses have been talking about burnout for years, but new data suggests that things have crossed into crisis territory. A 2025 survey from Joyce University, which polled 1,000 registered nurses from across the U.S., paints a stark picture of what work really feels like right now. Exhaustion that never seems to lift, missed meals, sleepless nights, and a growing number of nurses quietly wondering how much longer they can keep going. The numbers are hard to ignore. Nearly 3 out of 4 nurses, or 74%, say they feel emotionally exhausted multiple times a week. For Gen Z nurses, the newest members of the profession, it's even worse. More than 1 in 4, 28%, report feeling burnt out every single day. And this isn't just the emotional strain, it's showing up in basic physical ways. More than half of the nurses regularly skip meals or breaks because they're simply too busy. Almost half struggle to sleep most nights because of work related stress, creating a cycle where exhaustion feeds more exhaustion. And what's especially troubling is how many nurses feel they can't ask for help, even when help technically exists. Among Gen Z nurses, 1 in 5 have access to employer provided mental health resources but avoid using them, not because they don't need support, but because they worry about confidentiality or potential career consequences. And I have to say this is kind of a real concern. We do want to do our best, but you know, you do have to wonder too. There's also a clear gender gap. 40% of the women nurses say they're uncomfortable talking to their supervisor about burnout or mental health, compared to 26% of the men. For many, staying silent feels safer than being honest. All of this pressure has consequences for nurses and patients. Nearly half of 49% of nurses worry at least once a week that fatigue or feeling overwhelmed could lead to a medication error or other mistake. And almost half have felt unsafe at work in the past year due to verbal or physical aggression from patients or family members. Then there's overtime. 74% of nurses reported being required to work mandatory overtime three or more times in the past month. And I have to say, I will stop here and talk about this because I experienced that when I was a staff nurse, brand new staff nurse, of having to be mandated to work overtime. And there was a period where I was working 3 16-hour days back to back because I was on call the first day and we're required to stay. Then the second day, there was a call out, and I was on the call out rotation list because there was a nurse that routinely called out. And so no one wanted to work the shift after her or work a shift with her because they were always short staffed, or you would have to stay to cover what she was supposed to do. And then I was on call again to open up. So I ended up working 3 16-hour days back to back after working, multiple shifts, staying over, working 12s, and all these things. You're supposed to have adequate rest. And so their idea was, well, if you have option to get 8 hours of sleep. Well, how am I supposed to get 8 hours of sleep, ma'am? When I get off work, I work 16 hours. I take the 20 minutes to drive home, get in the shower, get something to eat. Okay, so maybe that leaves me, takes out about hour and a half. So that leaves me about 6.5 hours. But I still have to get up and, sleep for maybe 5 hours, get up, get something to eat, pack a lunch, get some clothes ready because I don't know if I'm ever going to get off work ever, and drive the 20 minutes back. And so that's what the reality is. And that's why I wanted to put this in context for you. Because a lot of times people think, oh, well, their nurses are just trying to get all the money they can. No, that's not it. There's a lot of guilt associated with knowing that, hey, I'm too exhausted to go to work. I just can't do it. But I don't want to leave my colleagues hanging because you know how that feels to be short staffed. And so you push yourself to go in and it may not be safe. It says here that in fact more than half or 53% of nurses say they've seriously considered leaving the profession, not once, but repeatedly over the past 6 months. That's a massive red flag for a healthcare system already struggling with staffing shortages. And it should be. Early career nurses appear especially vulnerable. Many enter the profession with passion and optimism, only to find themselves burnt out before they even had time to settle in. When new nurses are already thinking about leaving, it raises serious questions about sustainability. The study findings line up with what many nurses already know firsthand. Burnout isn't just long shifts. It's also about charting overload, constant interruptions, and systems that demand more without giving enough back. Studies show that nurses spending hours each shift on documentation report significantly higher burnout and are far more likely to plan an exit from the profession. And this is where I have to say, nurses, if you're listening, you don't have to leave your profession. You can leave your job, but you don't have to leave the profession. Find out how to turn those nursing skills into something else. And we're going to talk about nurses that are doing just that. But if you ever listen to my other show, the Nurse Shark Academy show, you meet nurse entrepreneurs and nurses that are doing big things, taking their nursing skills and changing things in healthcare. And you can be part of that too. You don't have to leave your profession. Just remarket, repackage, reuse. Okay. So it says, as you zoom out, the situation becomes even more alarming. Most healthcare organizations are already facing nursing shortages. A wave of retirements is coming because, as we know, the boomers are retiring, and some of them are they're between the pandemic and everything that's happening, the changes in healthcare, the demands, the violence that's escalating in healthcare. Now we're going to add into potential legal stuff happening with our current environment, political environment regarding immigration. You've got all these factors. Patients are angry, wait times are longer, and nurses are becoming fodder in this, right? And so a lot of older nurses are just saying, you know what, I can retire. I'm out. I'm out. Right. So the researchers describe this as burnout shorter cycle. Short staffing increases workload. Workload fuels burnout. Burnout drives turnover, and turnover makes staffing even worse. Rural hospitals and critical care units are often the hardest hit. The takeaway isn't that nurses aren't weak or unwilling, it's the opposite. Nurses are carrying too much for too long with too little support. So this should be a wake up call. And my question is, what are we going to do to fix it? Because I report on this, but how are we going to be part of the solution? One of the ways to do that is, again, for nurses to be vocal, speak up. I applaud the nurses that are striking because at least their voices will be heard. But how can we as nurses go forward and shape healthcare? And how can we be part of that? And so let's talk about it. Let me know what your comments are. But maybe we can help come up with solutions because what's going on right now, it ain't working. And we need to do more. Okay. All right. So here's our next story. Um, Says bankrupt hospital sues union over reinstated nurse accused of falsifying safety checks. This is from nurse.org. I sometimes put these stories out because my role is education as well. This is things of not to do. Nurses don't do these things. But I also want to highlight what's happening in real time in healthcare. So it says a Rhode Island hospital is fighting to uphold its termination of a nurse who allegedly falsified critical patient safety documentation, highlighting the tension between labor protections and patient safety standards in healthcare. Prospect Charter Care operator bankrupt Fatima Hospital has filed a federal lawsuit against the United Nurses and Allied Professionals union to overturn an arbitrator's decision reinstating nurse Victoria Galucci. There we go. After her termination for documentation violations in February of 2025. Sorry, Nurse Galucci. I just have a brain fart there for a second. Galucci and 5 colleagues documented approximately 48 safety checks for a patient who had been discharged hours earlier, with staff noting that the patient's supposed activities despite an empty, folded up bed. This suggested to management that Galucci and all of her co-workers had not, in fact, performed any safety checks that evening, but instead had rubber stamped all of the entries in the safety binder. The facility concluded this represented willful and intentional falsification of patient records, which I happen to agree on. The hospital terminated all 6 employees involved. 3 resigned immediately. 1 withdrew their grievance, and only Galucci's case proceeded to arbitration. During the hearing, Galucci testified to performing at least 6 checks and noticing the empty bed, but failed to report the discrepancy. Testimony the arbitrator found not credible. Despite confirming misconduct occurred, arbitrator Jeff Cassidy ruled in December 2025 that the termination lacked just cause under the collective bargaining agreement. He ordered Galucci's reinstatement after an unpaid suspension lasting from February 2025 to January 2026. The hospital's lawsuit argues this ruling violates Rhode Island public policy by requiring the reinstatement of a nurse who intentionally falsified safety documents. The case raises profound questions about accountability in nursing practice and the balance between labor protections and patient safety standards. So this is why I bring that up, because as I'm tutoring on the NCLEX and the nurse certification exam and things like that, these standards and ethics come up. And we talk about the standards of care. We talk about the code of ethics with the ANA, and what is your responsibility. And I'm sad to say that there are plenty of nursing students and nurses that really aren't familiar with the code of ethics and the standards of care. And that's a problem. So there's more to this in this story. You can head on over to nurse.org to read the full story. Just don't have time to get into it, but I'm bringing that up because I'm going to ask you, nurses, when was the last time you looked at the code of ethics and the nursing standard of care? And to follow up, when was the last time you looked at your Nurse Practice Act for your state? Okay, here's another brief story because we're just running out of time, and we're running behind today. A lot of things, emergency things came up, and a lot of good things. Don't get me wrong. This is good emergency, but it's a lot. So just let you know, some things have come up, and it's one of the reasons why we're kind of late today. So I think I'm going to have this story and one other that are in our session. It says data breach last year at Central Maine Healthcare affected more than 145,000 people. So more than 145,000 people, including roughly 138,000 Mainers, were affected by a data breach at Central Maine Healthcare last year. That's much higher than the 8 people that the Lewiston-based healthcare system originally reported to the Maine Attorney General's office. According to a notice on Central Maine's healthcare website, the data breach discovered last June an authorized third-party access patient information that may include names, date of birth, treatment information, and social security numbers. The health system says it's notified all patients whose data may have been involved in the incident. So earlier this month, a parent company, St. Mary's Health System in Lewiston, also notified the state that 478,000, there we go, people were affected by a data breach last spring. So higher than the initial 8,000 initially reported. So I say that to say, if you're there, keep an eye on your credit, your reports, your identity, and things like that. It's getting hard out there. I mean, it's just the constant battle. Okay. Okay, I've got a couple more because I just, there's certain things I just need to get to. So this came from Yahoo News, I believe. Yes. And this is going back to United Healthcare. We can't forget them. It says United Healthcare faces renewed scrutiny into its nursing home practices. What does that mean for UNH stock? In an election year, Washington, D.C. focused on Medicare Advantage oversight. United Health Group has become a prime target. Senators Elizabeth Warren and Ron Wyden have escalated their investigation into the company's nursing home practices after reports and whistleblower claims that some seniors allegedly died when hospital transfers were delayed or denied under United Health linked Medicare plans. At the same time, federal agencies are tightening audits at Medicare Advantage contracts and billing, signaling a tougher line on private insurers' managed care and reimbursement for vulnerable patients. This scrutiny comes as UNH shares, while recovering some ground after a difficult 2025, still trade about 34% below their 52-week high. Their third quarter 2025 results released in October were solid on growth, but showed clear cost and policy pressure. The company posted $113.2 billion in consolidated revenue, up 12% year over year, with adjusted EPS of $2.92 versus $275 estimate. So they had a 6.18% upside surprise that highlighted continued operational strength. So basically, they continue to make money, okay? But they're still facing a lot of scrutiny. So when you're looking at healthcare and you're looking at what's going on behind the scenes, it's not just what you see on the surface, right? And so I bring that up. So I want to share that kind of as a follow up from other things that we've reported with United Healthcare. There's been a lot of things going on with that company. We'll see, because as we're looking at how the stock market is doing, there's going to be some changes in the stock market fairly soon because it's cyclical. It happens. It's up, it's down. It's, So as you're looking at this, keep an eye on these healthcare stocks, because with the current landscape that we're having, increased scrutiny, these things coming out. It's going to be interesting to see what happens. All right. There is another story that I want to get to before, a happier story, but I did want to bring this out. Okay. So you need to be aware. This was in the New York Times, and it says medical groups will try to block childhood vaccine recommendations. And I say that because I didn't get a chance to get to the other story, but it's a backdrop of significant measles outbreaks that are happening right now across the country. Excuse me, as a rise in flu right now that's going on. So we reported on that last week. This is kind of a follow up to this. And it says 6 leading medical organizations plan to ask the courts to throw out revisions to the childhood vaccine schedule announced last week by Health Secretary Robert F. Kennedy Jr. and other federal officials. Mr. Kennedy and his appointees reduced the number of diseases prevented under routine childhood immunization recommendations to 11 from 17. The new recommendation, the new schedule recommends that vaccines against 6 diseases, including hepatitis A and B, rotavirus, and flu, be given to most children only after consultation with a healthcare provider. The medical group say those changes are not based on scientific evidence and will be harmful to the public. The medical organizations also intend to ask the courts to block a late February meeting of federal vaccine advisors handpicked by Mr. Kennedy. A federal court in Western Massachusetts has set February 13th as the date for the initial hearing on that lawsuit. These organizations continue with their attempt to hinder this administration's work through procedural and legal challenges, said Andrew Nixon, a spokesman for the Health and Human Services Department. Mr. Nixon said the Vaccine Advisory Committee, quote, continues to operate lawfully and transparently, and its next meeting is scheduled to proceed in February. Can I just point this out for a second? No shade for the sake of throwing shade, but I want you to see what it says, Mr. Kennedy, Mr. Nixon. Not Dr. Kennedy, not Dr. Nixon. So you have non-medical people making decisions about medical matters. When has that really worked out well? Very rarely, right? Because a lot of times people they operate off of one incident, one experience, their own experience, which may not translate to everyone's experience. And so we have to have the science, the data, the trials, and all that stuff to back up what we do, so that we just can't be, well, it worked for Joe, it's going to work for Mary. Maybe not. Okay. And so my concern is that we have non medical people making medical decisions. So, anyway, the plaintiffs include the American Public Health Association, the American Academy of Pediatrics, the Infectious Disease Society of America, the American College of Physicians, and the Society for Maternal Fetal Medicine, and the Massachusetts Public Health Alliance. The groups plan to meet next week to amend an existing lawsuit of decisions by federal health officials to limit access to COVID vaccines. And a separate lawsuit against HHS, the Pediatrics Academy also alleged the department cut millions of dollars in grants because the group criticized the administration's actions. A district court on Monday blocked the cuts from taking effect while the case proceeds. The 6 vaccines dropped last week from routine vaccination schedules are still available to any child with a healthcare provider's approval. And immunization requirements for entry to daycare and schools are enforced by states, not the federal government. But here's the kicker. If you don't do what the federal government says as the state, then they may try to cut your funding. I'm not saying that they will, but there have been rumors alleging such things. So my question becomes, what do you do as an individual healthcare provider sitting there with a family member, a patient's mother, a father saying, well, I just saw in the news that, other countries, they only give a few vaccines and we're giving way too many vaccines to our children and blah, 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 blah. That was an actual conversation that I had with someone, by the way. And I'm thinking, I said, well, you know, individually, you have to make a decision for your child. But let's look at the broader picture. Are we comparing apples to apples? Because I'm concerned about that. It seems like it's a little oversimplified to me. So I would like to see the data. What are they putting in those vaccines? Maybe their mixtures are a little bit different. Maybe they don't have to deal with some of the diseases that we do. Maybe they found a different way. I don't know. Can we learn from other countries? Definitely. Do I want children get stuck less? Of course. If we can, do more with less, that's always a good idea. But let's do it in a way that looks at the science and not at the emotion behind it. You know, and I think that's what's happening is that we're focusing too much on other things. All right. So let's get on. You can read more about that in the New York Times. I just don't have the time for it. Let me get on to our last story for tonight because I want to share this because I thought this is awesome and excited about it. And this is called Nurses Having Some Really Great, I don't know, uh, innovation. They're innovative. Sorry, I'm distracted by the phone because I've been keeping eye on our stream on the phone, and I want to make sure we're still going. And yeah, it looks like we're still going because sometimes I can't trust that machine, right? So let's go on. So anyway, so this is our last story, and this is our nurses making a difference. So two nurses got tired of bad hospital coffee, so they built the Caffeine Clinic coffee truck. Awesome. I think it's a great idea. The Cafe Clinic is a mobile coffee station that travels directly to healthcare facilities and expanding to offering delivery to nurses right at their hospitals. What started as a joke between two nurse colleagues in October 2025 has evolved into a successful mobile coffee venture that directly addresses the problem of limited access to good coffee during busy shifts. Nurses and owners Nicole Smith and Elena um, Villanueva have created a medical themed menu featuring 16 specialty drinks with clever healthcare inspired names such as ICU Wake Up Call and Cold Caramel. So these two Texas nurses have done a great job. So I think that's wonderful. So instead of just grumbling about it, they decided to fix it. So the Caffeine Clinic is a coffee shop on wheels, and they can take them right to it. And there's pictures here. You can go to nurse.org to see this. There's pictures of their mobile station. It's like a food truck. And it says when you're a nurse, it's hard to leave during the day to go get a cup of coffee. So we decided to bring it to them. I think that's wonderful. And so I want to congratulate these two nurses. And hey, if you're listening, I'm gonna try to find a way I can reach out to them because I love to talk to them about their idea and get them on the other show. But the coffee clinic operates 2 to 3 days weekly, posting their schedule and locations on their page so that customers can track their whereabouts. And starting in January, which is this year, of 2026, they also plan to expand services to include direct delivery. It would be great if you could like Uber Eats or something, so we could Uber this. I don't know. I'm just trying to figure out a way to get their coffee to them. So hospital employees can place their orders ahead of time and have their freshly brewed beverages delivered hot or iced, of course. That is awesome. So again, nurses are so entrepreneurial. We've got more nurses that are starting their own businesses, and I think that is wonderful. Two Texas nurses came up with this. And that's why I said, you know what? You can leave your job, but you don't have to leave your profession. This is what nursing innovation looks like. One cup of coffee at a time. I am so grateful for that. That ends our segment for today. Thank you for tuning in. I will see you next time. Just a few brief announcements. We'll be coming up with some new events that will be planned in February. Don't forget that we do have training classes available. Head on over to Baxter Professional Services HealthEducation.com. If you want to know more about the Nurse Shark Academy and becoming a nurse entrepreneur, you can head on over to the NurseSharkAcademy.biz. And if you're watching us on YouTube, don't forget to subscribe and hit the notification bell so you are notified of when we go live. And also check out our other show, the Nurse Shark Academy show. And you can find it on YouTube, but also on Podbean with our podcast. And wherever you get your podcast, you can get it and download it. If you're on Facebook, give us a like and a thumbs up. We mostly appreciate it. And then thanks for tuning in. Share our content. If you have a local event that you want me to promote, let me know. Be happy to do so. Thanks a lot, and bye bye.